Eddie Kerber with Bioplastic Surgery. Today's patient story, hybrid nerve reconstruction. Modern nerve surgery requires that we combine several different types of techniques like autografting, allografting, nerve transfer, several others to achieve specific and highly individualized results. And this patient story kind of illustrates that. This is a 67-year-old gentleman who had a distal radius fracture and noted immediate onset of dense sensory neuropathy and progressive weakness of the thumb in the median nerve distribution. Unfortunately, he was sent to me 9 months out from his injury with a stagnant Tinel sign at the distal forearm. Here's his pre-op examination. Still kind of numb in these fingers?
Yeah.
What about over here?
They're fine.
That's fine, right?
Yeah, those two.
What about these guys?
Right, like I said, the thumb and these two fingers.
Sure.
Those are the dead ones.
Okay, so he had a distal radius fracture back in September of last year. Stagnant Tinel sign about here with persistent median neuropathy, a dense sensory neuropathy, and some weakness here.
Big time.
Here again demonstrating his pre-op exam. Here we are in the pre-operative area. In addition to his dense sensory neuropathy, median nerve, you can appreciate the atrophy here of the Thenar eminence on the left side compared to the right with good bulk and tone here. So he's taken to the operating room. You can see the dotted line illustrating his previous incision, my incision plan there. The median nerve was dissected out and was found to be heavily encased in scar tissue. An extensive neurolysis was performed as shown on the left. Even after the neurolysis, intraoperative nerve stimulation, no response for the Thenar motor branch. I'll talk much more and show that shortly. And you can see in the image on the right, a very focal neuroma. This is an area where it's dotted in purple that is firm to the touch. It's constricted. There's an hourglass deformity right there. Nerve should be soft and pliable. This is a focal area of conduction block, a Neuroma-in-Continuity. Decision was made to resect that, as shown here, reconstruct it using an Axogen allograft, which is size matched appropriately and avoids donor morbidity for a targeted sensory reconstruction. Now for the motor reconstruction, decision was made to proceed with a transfer, shown here. This is the dissection. The Thenar motor branch is identified. The abductor digiti quinti nerve branch from the ulnar nerve is identified. Here is the intraoperative nerve stimulation. Intraoperative nerve donor evaluation. You can see we've dissected out the ulnar nerve. We've got the, do you mind lifting this one ever so gently? Just like that. We've got the deep motor branch. We've got the volar sensory component. We've got the hypothenar. So if we stimulate the deep motor, you can see a lot of activity deep. Stimulate the sensory here, nothing, and our targets, our donors for this transfer, right here. If we can watch the hypothenar area, you can just see that subtle contracture of the abductor digiti minimi. I can see it contracting there. That's going to be what we use to power the transfer. And then recipient. Intraoperative evaluation of the target nerve. This is the median nerve that's dissected out. And you mind lifting that one just a little bit. There you go. That's the Thenar motor branch. I'm going to stimulate it. Physiologic settings, and I get nothing from the thumb here. So here's the preparation for the nerve transfer. You can see the ADQ motor branch is prepared in relation to the Thenar motor branch. Tension-free coaptation is performed. A nerve wrap, hyaluronic acid-coated nerve wrap, is applied to protect the coaptation. And there's the final result there on the table. So I hope you enjoyed this patient story. It illustrates nicely. There is no algorithm here. Patient presents to you at different time points, and you have to utilize all the tools in your tool belt to achieve the specific outcomes that you are seeking. As always, make sure your surgeon's board certified. Ask for pre-op and post-op pics. We'll see you for the next patient story.